Welcome back to the Medicaid Mythbusters series, where community change action is clearing up common misconceptions about Medicaid. Lately, we're hearing a lot about waste and fraud and abuse in Medicaid, so let's break this down. Republicans are pushing to cut Medicaid funding, claiming it's plagued by fraud and waste. But what's really going on? Here's the real story. Some politicians are using exaggerated concerns about waste to justify drastic cuts to critical programs that support caregivers, children, seniors in nursing homes, people with disabilities, pregnant women, low-income families and individuals with chronic health conditions, and more. In reality, a very small portion of total spending is affected, with most of it being due to clerical errors.
So they're using clerical mistakes as a reason to slash the program?
Exactly. While there are some bad guys out there and some improper payments do happen, most payments flagged as improper are made for covered healthcare for people who are legitimately eligible for Medicaid. These are people who are trying to game the system. Most of the time, the issue is that paperwork for the payments is missing. And actually, people who use Medicaid for health insurance are pretty unlikely to commit fraud against Medicaid. That's because, with limited exceptions for people with disabilities, Medicaid does not pay enrollees. It pays healthcare providers, like hospitals and pharmacists, for the covered healthcare they provide to enrollees. But instead of improving Medicaid with better systems, some elected officials want to cut Medicaid altogether and hurt those who need it most. It's a distraction from the real solution, which is including more people in the program and reducing paperwork and hoops for people and healthcare providers to jump through to claim these benefits, not taking away healthcare for workers and families who need it.
Who's pushing for these cuts?
Well, mostly Republicans, who see these numbers and argue that Medicaid needs to be cut to reduce waste. But they can't relate to me, or you, or our grandparents, or our parents, who need Medicaid to see their doctors and pay for their medicine. For millions of people, it's their only option for accessing healthcare and the ability to live independently.
So the real issue isn't fraud. It's that they want to cut a program that's working for millions.
Exactly. Medicaid is a lifeline for 74 million people. Cutting funding to fix imaginary fraud isn't really intended to help average people. They're about funding tax cuts for billionaires and paying for their deportation machine.
I see. So they're taking away from ordinary people to benefit billionaires and pay for heartless attacks.
That's right. We can always improve efficiency, but slashing Medicaid won't solve anything.
So next time I hear someone talking about waste and fraud in Medicaid,
you'll know it's just a myth to justify taking away healthcare for those who need it most.